Okay, we're live.
All right.
Hi, everybody. Welcome. Thank you for joining us. Sky, do you want to get us started?
Absolutely. Thanks everyone for joining us to talk about something that's very near and dear to my heart, which is the issues that the recovery community faces, especially during a crisis time like during COVID-19. We are thrilled to have National Advocate Ryan Hampton here with us today. And he'll tell you a little bit more about what he does. One of the organizations that he works with, the Recovery Advocacy Project, is we are putting this on today. And the Recovery Advocacy Project is really an opportunity for anyone who cares about issues that impact the recovery community to become trained to be an advocate and to really make changes that impact our community in a positive way. So with that, I will turn it over to Ryan. And Ryan, you can feel free to tell us all about yourself.
I'm just going to take a minute, and I want to thank you, Sky, and thanks to particularly Jessica and Sky who helped pull this together. My name is Ryan Hampton. I'm a person in long-term recovery from addiction, substance use disorder, which means I haven't felt it necessary to have a drink or a drug or any other mind-altering substance since February 2nd, 2015. I'm also a writer, an author, an advocate, an activist. You know, I consider Wisconsin like a second home to me. I'm just the blessings of recovery. I'm getting married in November. I got side note, I got engaged back in June to a Midwest from Minneapolis, so almost Wisconsin, but close enough. It brings me there plenty, and I'm really grateful to have done some work with Wisconsin Voices for Recovery, and thank you to Wisconsin Voices for Recovery for helping to be a partner with this town hall. Like Sky mentioned, I work with and the organizing director for a 501c4 organization called the Recovery Advocacy Project. We exist to give people like you a voice. It has been my experience throughout my recovery that there has been a lack of training, coordination, and real direct advocacy and activism for people with lived experience. And Recovery Advocacy Project exists to give those voices a space to be involved, to also provide them with the training, the tools, the necessary resources to pull off important conversations just like this. I was just absolutely thrilled that many legislators and individuals and advocates who are so deeply ingrained and involved in the issues in Wisconsin were quick to join on to this town hall. RAP, which is the acronym for Recovery Advocacy Project. We've hosted over 50 of these in several states around the country. Many of the issues that have come up have been similar, but the way that each state and each community combats and takes on those issues is obviously different because each state has a different set of circumstances. But I think now more than ever, we all realize, given COVID-19, given what's happening in our world, that the work of recovery advocacy, the work of recovery advocates and activists and community-based organizations is more important now than it ever has been. And Sky, Jessica, everyone who has joined this call tonight, thank you for your work. I'm really looking forward to being a part of the conversation and kind of co-moderating this with Sky. And with that, I'm gonna pass it back over to you, Sky.
So anybody that knows me knows that I've been kind of a fixture in the recovery community and the recovery advocacy community for probably around 16, 17 years now in Madison, my hometown. And the panel that we have here tonight is really exceptional, not just because of what they do and the people that they are, but also because every single one of these people has some personal connection to our community. They're a part of the recovery community, and so we really welcome them with open arms tonight. On our panel, we have Senator Janet Bewley. She's the state senator for District 25. She also serves on SCAOTA, the state Committee on Alcohol and Other Drug Abuse. There's a lot of acronyms. Sorry if I got that wrong. Representative John Nygren, who is the state representative for District 89. Representatives Nygren's Hope Agenda. We have anybody that's done recovery advocacy work knows about that Hope Agenda and what it's done for our community. He also serves on the Substance Abuse and Prevention Committee. Representative Melissa Sargent is the state representative for District 48. She serves on the Committee on Mental Health and Substance Abuse and Prevention, and has done a lot of work around recovery housing, which we really appreciate. The fabulous Miss Charlie Daniel joins us tonight. She is the founder and innovator of the African American Opioid Coalition and one of my personal heroes. Fred Garcia is the Waukesha County DHHS supervisor, and Fred brings bilingual services that our community desperately needs into the field. Sharon Murillo is not only the CEO and president of ServeURX, but she is also an affected parent. Dennis Radloff is a harm reduction coordinator that has been in this field for a very long time and works as the MA.
Hello.
Am I the only one who can't hear her?
Hi,
Sky.
Scott. I think we lost you there for a second. We lost your audio.
This is Miss Charlie. Can you hear me? I'm on the phone.
Yes.
Yes. Hi.
Yes.
Sky, your audio's off.
I don't think she can hear us either.
Let's see if we can unmute her. Everyone, we apologize. These happen now that we're in a Zoom technical world. Sky, can you hear us? I think we've lost Sky. Okay. Jess, do you want to work with Sky and I'll go ahead and pick it up while we get Sky back online?
Sure.
Okay, great. Sean, if we could go ahead and move to the next slide, I'm going to go ahead and pick up for Sky while we're trying to get her back online with her audio. We could go to the gallery view. Great. Everybody, thank you so much. And Sky, just stand by with us. If you could work with Sean and he'll get you back online with your audio. We lost your audio for a second. The first question that we went ahead and surveyed questions out to everyone who is participating tonight. And I see we've got well over 88 folks who have joined. The first question is posed to everyone. We're seeing an alarming rise in overdose deaths during COVID-19 in Wisconsin. The folks who are listening and who have logged on tonight would like to know, what are the strategies that you and your organization are considering to decrease this rise? And I guess, Fred, we could start with you, if that would be okay.
Sure. Thank you very much. Again, I appreciate everybody who put this town hall meeting together tonight. As a bilingual, bicultural social worker in Waukesha County, one of the things that we have to do a better job is connecting with the Latino community in a way that a message can be heard by somebody that they trust. As you might guess, with COVID and all of the other issues that are currently going on in our country and throughout the world, quite frankly, there's a lot of distrust that's out there with regards to treatment providers as we try to reach out to the Latino community. I can talk a little bit about what's happening in Waukesha, and we have very few AODA therapists and counselors that are working with the Latino community and who the Latino community trusts. So there's a lot of stigma still around regarding addiction. And I think that a way that we can work on lowering the high incidence of drug overdoses is to start some kind of a campaign for everybody, not just for English speakers, but for other languages. And somehow we have to do a better job, excuse me, of connecting with that community so that the information can be heard. Long term, we need to get more people in the field who are bilingual, bicultural, and also have more training with regards to cultural competency, because there's a lot of misunderstandings between cultures, which also can be a great barrier to receiving services. So I can tell you in the Latino community in Waukesha, especially in a lot of our smaller communities where everybody knows each other, the issue of confidentiality is very, very challenging for a lot of our Latino families to come in looking for services. And also, clinicians have to have a better understanding of the cultural differences within different minority groups to provide culturally competent services to all family members.
Thank you. Can we, Jessica, bring you in on this conversation? Jessica and Monty.
Sure. So can you just repeat the questions, the first one?
Sure. We're seeing the massive overdose deaths, overdose uptick in numbers, just strategies that different organizations are putting into place, you know, moving forward that are going to consider this rise in overdose deaths and what we can be doing about it.
Ooh. Jessica, I can chime in real quick.
Sure.
Yeah. So I hopped on board with Wisconsin Voices for Recovery because I obviously for all the work that they've been doing, but my goal is to shed light on how the opioids and addiction has really been fortunately impacting African American community, really the minority populations. And pretty much what Fred said as well, the goal is to continue to break down the barriers, but also we got to provide enough education within these communities to allow for them to understand.
Looks like we are striking out on tech tonight. We've lost your internet, Monty. So we can move on for right now until we get back to Monty. Dennis, I was wondering if you could respond to that. There we go. Monty, you there?
Yeah.
Okay, great.
Oh, sorry, did I cut out?
Yeah, just for like the last 15 seconds.
Oh, okay. Well, I was pretty much just explaining like my job at Wisconsin Voices for Recovery is to really focus on providing education, reaching into these minority populations and really helping them out with becoming more educated with some of the benefits that are out there for them.
Thank you.
Do you want to take a turn with that too?
Oh, Sky, you're back.
I am. There was a massive thunderstorm that went through.
Dennis, I think we were moving to you next, my friend.
Sure. Definitely a big impact that is occurring in our recovery community in the shadows of this COVID-19 pandemic. And some of the things that we've worked on from our department at the Division of Care and Treatment Services has been expanding our Narcan Direct opportunities to these services that we're able to remain open, to increase our capacity at distributing and educating on, doing overdose prevention education and Narcan distribution more into the hands of people who are at risk. Speaking to Mr. Garcia's point, some of the things we were able to accomplish as we were supporting our OTPs in their services was we have been able to get translation of, we have a training video at DHS that covers all 4 formulations of Narcan. And we've been able to get that translated with a voiceover for our Hmong speaking communities and also our Spanish speaking communities. And then we have a couple of educational handouts that go in conjunction with any of our Narcan Direct entities on how to administer Narcan, and another one is the overdose signs and symptoms and overdose risk factors, which are also translated into Spanish and Hmong translation for those members of our community as well. We've also worked at expanding additional funds to our currently funded providers that have Narcan capacities around the state to increase that. We've expanded capacity for our peer support services through ED2 recovery. We're doing all we can with what we have in place to respond in the here and now at continuing to increase and provide as much Narcan and overdose prevention education into the community as possible.
So Dennis, that brings up a really good point that, we're all trying to do the best with what we can, what we have to be able to do our work right now. Has there been any discussion about how the state is going to deal with the influx of people that are going to need services after social distancing ends? After the upheaval that's been in our community over the past 4 months. And, we know that, a lot of people are out of work, and so our tax base is going to be smaller. Do we have any plans for how to prioritize recovery issues with that understanding?
That's an excellent question. And it's, everything I've been involved in, we're fully aware of the impact and have been hearing it from our county mental health providers, our mental health coordinators, or substance use coordinators from our tribes and our counties around the state. And just what we've learned from the impact through COVID, we know that we've seen a disparity and an impact on those direct services for support, whether it's recovery support, treatment services. We know that there's been increased substance use. Like you said, the loss of income, it's causing challenges even beyond just support systems, that it's having the impact on individuals, for housing, and, individuals are being unhoused. And one of the big things that we've worked on, at least for frontline provision and support to our providers, has been a lot of technical assistance and support in working with Medicaid and increasing the capacities and abilities to deliver telehealth services, at least for our outpatient services and group services. And we know it's a hefty and aggressive timeline, but we are looking to try to fully implement Medicaid's telehealth policies by the end of 2020, as we're bracing and anticipating, a projected resurge of COVID come in the fall. And I think that all around, whether we're talking about mental health services, substance use services, or just our community support services, it's community support group systems, whatever individual's path of recovery may be, we're learning and discovering how important it is to have the virtual platforms to maintain as much connectivity as we can, as we've been learning. So a lot of work has been going into that. Our call line and our call.
Can I turn it over to Representative Nygren, since you work on our state budget? Is there anything that can be done at that level in order to protect the recovery community?
Well, I think there is. First of all, can you hear me okay? You can just nod if you can. Okay, great. Well, I think there is. First of all, the state, through the Federal CARES Act, received about $2 billion. Not all of that has been spent. I believe last I checked, there's about $400 million. So there's money sitting there available that could be tagged. However, I guess I also want to point out that my understanding through a Government Accountability Office report, there's about 40% of the original STR, SOR funds that are just sitting there and waiting to be used. So we haven't truly utilized the resources that we have available. We can always have discussions about more resources, but when we aren't truly utilizing the ones we have from a budgetary standpoint, that's a difficult conversation. And I just want to weigh in a little bit on the previous question about what we're going to do or what can we do. I think it's important for us to realize, I mean, there's going to be a lot of opportunity for us to rehash what happened, what went right, when went wrong in the COVID response. But if we have another spike, like was just mentioned, hopefully we've learned enough that we don't shut down our healthcare system so that needed treatments for substance abuse, counseling, other mental health services don't just stop like other healthcare treatments did. Milwaukee County reported a 70% increase in EMS calls early on during COVID, a 54% increase in response to the drug overdose, and even worse, an 80% response in suicide. So the problem is large. If we do see another spike, hopefully we've learned on what not to do next time. And what not to do, in my opinion, was not completely shut down our healthcare system. And then this is not pointing fingers at the federal government or the state government. We all bear some responsibility here.
So take those lessons learned is what I'm hearing from you. Yes.
Is there, Sky, I mean, I think it would be interesting. One of the things that we've seen in other states too, because there are a lot of legislators here tonight, there's like, I don't think anybody's fooling themselves and saying that there's going to be budget shortfalls, right? There are going to be massive gaps that are going to need to be filled. And like Representative Nygren just said, the General Accountability Office has a report, and this isn't just unique in Wisconsin. I mean, I think the national average of unspent the state targeted response, state opioid response dollars is somewhere around 50%, and I believe in Wisconsin, you're right, Representative, it's about 40%. But even knowing that, what type of assurances can the recovery community, people who need help in this state have that, what I would consider essential substance use disorder, mental health services are not going to be first on the chopping block when those very important decisions around the budget happen. I'm sure those conversations are going on right now.
Well, I'm not sure if that was a question, but of me, but I'll respond to it. First of all, I think there's some good news. In the month of April, our revenues were down almost $800 million compared to the year before. May looked much better, and I'm hopeful that June will get better as well. So maybe things aren't as bad as they had originally looked. But originally, when the CARES Act was passed, I made one request of the Evers administration. He originally put out a bill that spent, I'm not sure how many hundreds of millions of dollars. And my response was, let's spend the federal money first, because states have to balance our budget. The feds don't. So we have limited resources. Thankfully we have a rainy day fund, which is all-time high. We had ending balance, which was high at the time. It's gone now. But we were in a good position. So before we start spending GPR dollars that are limited, because we have to balance our budget, let's make sure we use those federal dollars that I just mentioned first. And there's still some available for treatment community. From my standpoint, first of all, you're not going to see significant cuts to Medicaid because we have maintenance of effort. You might see, as I'm sure DHS on the call, you might see the line items change a little bit from area to area, but that's where it comes on people like me and people communities like yours to advocate on behalf of what's important to you.
Do you have a response for some of the other legislators that might want to jump in on this conversation? Oh, Senator Bewley, I think you're muted. Let me see if I can unmute you.
No, I appreciate Representative Nygren very much. The point is that we have all worked very hard to try to come up with as many creative programs as we possibly can. But I do want to point out that the amount of money that's left from the CARES Act, that a lot of it's already allocated. It hasn't been dispersed, but a good deal of it is yet to be allocated to departments and programs that have received none of the money yet. So and the other thing that I want to point out is that that's one time only. Unlike the budget, which we hope we can build year after year, biennium after biennium, the CARES Act money, we have no reason to believe there's going to be any more. I mean, it's it's there. Now, what we do know that we can access, and if there was ever a time to make the case that we should have accepted our federal money on Medicaid expansion years ago, we have missed billions and billions of dollars that could have been allocated to many of the programs, including helping people in recovery, helping people not even get to the point of addiction. But we have neglected to do so. I think that now, ultimately, what is it going to take? A pandemic? Yes, I guess it does take a pandemic to have us do the right thing and expand Medicaid. And again, this is our money. We already paid it. It's waiting in Washington for us, and it's ours. The other thing about Medicaid is that unless we get more or the state allocates more, it's a zero-sum game. So if we make the appropriate decision to allow for funding of telehealth, well, it's not new money. It's not like we minted money and we can put it there. It comes from somewhere else. Somebody else's payment is going to go down. Something that used to be paid by Medicaid won't be. So the only way we can increase is to accept the federal money, our healthcare money, so that then we can actually have real money coming in year after year after year. The other thing that I want to point out is that I have an approach that is a little unique, and by no means mine complements all of the important and very, very necessary approaches. But I come from an approach that looks at the social conditions in communities and looks at what we do to hold people up so they don't fall. And I know that many of you are very familiar with trauma-informed care. And you are aware that when someone undergoes trauma, if there's resiliency built in, either in the family, in the community, or in the society in general, if there is resiliency built into the system, real simple things, access to healthcare, access to transportation, access to the cell phones and the internet, those basic things that can hold you up, those are the things that can allow people to cope with trauma, and I believe help people overcome challenges in their lives so that they don't resort to substances to which they can and too often become addicted. I've been in recovery for 26 years. I never would have been able to stay in recovery, to get to it, if there wasn't a community and resources that could hold me up. Someone mentioned, and I think it was Fred, and I think Monty also pointed it out, that we have to maintain connections. And with COVID, our inability to maintain connections it is put in such a sharp contrast. If we can't maintain connections when COVID isn't there and people fall into addiction and we can't get them out of it, how desperate are we now when the connectivity is almost gone? And I'm thinking of rural communities, that again is my perspective. Many people, particularly the fragile ones who are in recovery, do not have access to the internet. I have said that like I'm a broken record. And I talked to an administrator of behavioral health at a facility near here who said, when COVID hit, we lost them. We lost them. They were gone. No more inpatient. They couldn't admit. No more walk-in for services or counseling. And no cell phones. If they didn't, he said, I wish we had given them all burners before they left, because they're gone. We have no way to reach them. And again, telehealth is wonderful, but until we can, again, guarantee, if we can have communities that offer resilience, 15% of our state has the inability to get internet because there are no providers. And even with broadband grants, they won't go there. So we really must address what it is that we do as a society and as a government to see to it that people can stay healthy and connected before they get sick.
I would like to add just a little bit to what Senator Bewley just said, and that is that, you know, I think we are all in agreement that we have a lot to do as a state in order to properly address mental health and addiction treatment and support of people who are living with mental health and addiction every single day. And I believe that the pandemic that we are experiencing right now is only highlighting the work that we need to do, and the fact that we haven't done enough as policymakers, and we have so much more that we can be doing. And I am hopeful that, you know, despite the fact that there are so many people that are suffering more now than they were than if we had not had this pandemic, that we can use this as an example of bringing people together and investing in and supporting our healthcare systems and our people, quite frankly, in order to be able to make our state be a stronger place and help our citizens be healthier. We have a lot of work to do in order to even remove stigma still. Too many people are uncomfortable talking about challenges that they are living with every single day. And then once they do open up, they're told that there's a big long waiting list in order to be able to have access to help. And whether or not that waiting list is about seeing people in person or having access to telehealth, whatnot, when someone raises their hand and is brave enough to be able to say, I need help, we as a society should be there with open arms and the opportunity to help them right then and there. There should not be 1 minute of waiting that has to occur. Unfortunately, that is not the case for too many people. And this is not only devastating to people who are living with mental health and addiction every single day, but it is devastating to their families and their friends and to their employers. So I am hopeful and, you know, try to see the glasses half full in the work that I do, that we can learn from this situation that we are experiencing right now, and take these real experiences in order to make positive life-saving changes through the legislature, but also look at what it is that has been happening in the private sector, in the nonprofit world as well, in filling the holes and gaps that currently exist, and helping make Wisconsin be a safer and stronger place for everyone.
I think that's a great segue into, I had one more question kind of add on to that, specifically for our legislators. I think I'm going to probably want to bring in Sharon for this as well. Sharon and I, you know, we actually met and have been doing a lot of work together on the opioid litigation, particularly in this last year. I'm on a watchdog committee, official committee, specific to the Purdue bankruptcy, and Sharon's involved on their ad hoc committee of victims. And we know, you know, you had mentioned stigma, and Senator Bewley, you had mentioned, you know, holding people up, lifting people up. And we know that we're in the midst of this kind of economic situation that's happening in Wisconsin. It's happening around the country. People are struggling with job loss. People are struggling, families are struggling with insecurity. And within the context of this opioid litigation, most specifically the Purdue bankruptcy, people who have been harmed by this company do have victims, I guess you could say, have an opportunity at individual recoveries. It's their only opportunity. Families who have been hurt, who have lost their children, people who at the hands of, you know, Purdue Pharma got addicted, spent money on treatment, had job loss. They have an opportunity at recoveries through this, and much needed recoveries at that. Sadly, I think, you know, one of the things we've seen is a lot of states, and Wisconsin, quite frankly, being one of them, saying that they have an administrative claim over their constituents' claims, saying that the state should receive the money for how the victim was harmed. And we're seeing them not necessarily say that the victim should receive, you know, some sort of direct payment compensation. And, you know, we know that abatement is a big part of this. The state should receive a tremendous amount of money in abatement from these opioid companies. Nobody, I think, is arguing that fact. I think that the states have been harmed as well. But the victims were harmed as well too. And I just wanted to see, Sharon, you might want to add on to that, but how do our legislators feel about their constituents being able to have a direct claim specifically against Purdue Pharma and receive recovery as well?
Yeah, the only thing I would add to that, Ryan, is that I think it's kind of ironic or interesting, at least, that individual victims that are trying to file claims in this bankruptcy have to prove the use of a prescription that was manufactured by Purdue Pharma. Yet states and others are filing claims that are somehow taking precedence over the victims, and they themselves don't have any onus to prove that it was actually that the harm was caused by Purdue Pharma. And I think that the state's claims are a derivative of the victims' claims, and yet the victims are somehow being put behind the states.
Yep.
Well, I'll have to admit a lack of knowledge about this. So if you could give, I did not know about that hierarchy of claims, but is this state to state, or is this based upon the federal, the whole court decision?
So this would be state. I mean, it's the states are kind of lumped in together, right? And Wisconsin is one of the states that hasn't agreed to a settlement framework. But one of the things I think that victims are looking for is for a state to stand up and actually say that victims have valid claims, right? I mean, there are thousands upon thousands of people in the state of Wisconsin who have filed legitimate claims against Purdue Pharma for recoveries. And the state has yet to step up and say, we believe that those victims' claims should also get paid, that individuals and families. I had a call, just a quick story, about a week and a half ago as a result of the work that I'm doing on this committee from a family in the state of Wisconsin that is very, very concerned. They're trying to keep the lights on, pay for healthcare for 2 children. One of this lady I spoke with, her daughter has NAS, needs to provide services, and is asking, if her claim is going to be valid. And we have yet to see states step up and say that victims' claims are valid and should take some sort of precedent.
Well, I find this, I will look into it. So the state of Wisconsin does have the ability to accept the money and then take part of it and distribute it back directly to the individuals who have, does the state then have to prove whether or not that claim is valid, or has that already been done?
So that's where the big fight is actually right now, is they're trying to figure that process out currently.
Okay.
Where it's actually one process around the country, all 50 states, where people can, put their claim in and be able to get paid out of a pot of money for damages that were done to those individual victims. And, very transparent rules across the board, as opposed to each state saying, no, we're going to take the money and then we're going to figure out who the right people are or who has the valid claim. There would be a trust and independent fund, just like the states would have their own fund. There would be a fund for victims and people who are harmed by the company.
And does that decision rest with the AG's office or the governor? How is it the AG?
It rests with ultimately with the judge overseeing the case, but the AGs could advocate for something like that.
I see.
And they have not.
Okay.
They have not. They've been representing the state's interests clearly because they're the state's AGs and want as much
Okay,
recovery
thank
from
you.
the state as
Thank you.
possible.
I did not know about that. Thank you very much, Ryan. I'll look into that. I appreciate it.
We as a legislature could weigh in. As legislature and governor, we pass the laws, governor signs them into law. I actually authored a bill on this issue that would have created a foundation and a trust fund where the settlement funds would have been deposited. I believe it made it through the committee in the assembly. I don't believe it made it to the assembly floor. We had the counties at the table. We had the state was at the table. Honestly, the families were not part of that conversation. I would just say that nobody probably understands the plight of families better than I do, families and how that can be affected. But there is an interest and a desire to be able to come up with a plan where I don't think we want any type of settlement to be used to balance our budget like was done with tobacco settlement funds years ago. So there is an interest in getting to a good place here. The problem is, from a budgetary standpoint, so the idea would be we create this foundation, it would be independent, it would be used, at least that was the idea, it would be used for abatement, so ongoing treatment, et cetera. Yet, even though there's this foundation that's created and it would help fund treatment needs throughout the state, that doesn't mean the asks that would be needed of the recovery community stop. They would still continue to come to us. So I think from other folks within the legislature, there was a concern that we're going to wash our hands of how we decide to spend the money in the future, yet the demands on the state were not going to go away. So I think that's the main reason why the bill didn't make it all the way through the process. But I have an understanding and a willingness to try and get there personally, and I'd be happy to have other colleagues on both sides of the aisle work with us on that. But the issue comes down to what the magic numbers are as far as who's willing to get from when you start beginning to slice up the pie, for lack of a better term. I know we're talking about human lives here, and it's not a great topic to talk dollars and cents, but that's what this is going to come down to, because it's about people being able to balance budgets, et cetera, in the future, and that's where the fear comes in.
If and I don't want to belabor it, but I just think, you brought the stigma is such a big issue that goes on. And it's like, if this were any other major like what Purdue did, we know, and the harm that was caused by this product by people. If it were any other product, right, medical product, faulty product or medication, people that were harmed by that product, no one would be questioning the fact of they should have a legitimate claim, be the direct claimant into that company to be able to have some sort of reparation from that company. But it's different, obviously, because we're in the midst of a public health crisis. And also there's still a tremendous amount of stigma that exists for people who use drugs, people who have been harmed by the product, who are in recovery, families. Like, there's a stigma. And one of the frustrations is we talk about stigma, yet we have states coming in and saying, yeah, but we should get the money and then figure out what to do with it. Not necessarily you, because you're an addict or whatnot. Like, we're the ones who paid for the services. So we are actually been harmed. So I don't want to spend all the time talking about this, but it is definitely something worth looking into, and something that Wisconsin could be a leader on.
So just to follow
that
that for just a second, I would say there is a good correlation with tobacco and with the Purdue Pharma case, in that people were harmed by smoking. I think one of the differences is I'd have to go back and look at the case law under the tobacco settlement, but my understanding is families had and people that were harmed by tobacco had a different class action lawsuit than the one that we're talking about now.
Well, because it wasn't in bankruptcy. It wasn't in bankruptcy.
Right. The fact that everybody's in the same lawsuit is where it gets really, really complicated.
Right.
And although, having states control some of the dollars and put into abatement is a wonderful idea, it doesn't do anything for the victims, the people that have lost their lives, quite honestly. Tens of thousands of families who've lost loved ones wouldn't benefit from money put into abatement. I'm sure they'd be happy to know that we're trying to do something to prevent further addictions, but they have a right to the dollars that are going to be paid out by Purdue, a company that obviously committed some pretty egregious acts and took a lot of lives in the process. So although the state deserves some of that money, we'd like to see a separate victims fund set up aside from what the states get.
So as we're talking about families that have been harmed by this, I'd love to get a sense of where people are at with affected family member services. This has been an ongoing struggle in my career as a therapist, because family member services have to be billed under mental health codes, as opposed to substance use disorder codes. And so there's so many times when affected family members don't get therapy or recovery community supports or group supports that they need to be in a healthy place. And every family member that I work with will tell you that their recovery is a separate journey from their loved one's recovery. Is there anyone that would like to weigh in on how this impacts family members and what we can do to provide for them? Sharon, since you're our resident parent, what are your thoughts? What if family really need?
I think you definitely articulated the fact that the family members are kind of left behind in the whole process. And as a mom who has a child struggling in recovery, it's been very frustrating. So I want the answers. I don't have the answers. I can tell you I've definitely been affected by this and continue to be affected by this. Family members just and oftentimes are not even included in the therapy. We're told we will be, and there's family meetings, and especially with COVID, who I happen to be affected by COVID and everything going virtual, family members were really kind of excluded completely. And that's such a missed opportunity because we know how important it is to have the family involved in this and the community involved in this and supporting the people that are struggling in recovery.
Sky, I actually have a question for you, and maybe we could bring in the rest of the panel too. So, you know, COVID-19, you know, we know has been causing unemployment, early release of many people from jails, and the recovery housing community specifically has been really struggling to meet those needs. Eviction, you know, protections that have benefited a lot of people in Wisconsin did not include language that protect some of our most vulnerable. I mean, you had authored a phenomenal op-ed, which was when we had first connected around this. What is it that can be done, right? What is it that can be done, you know, now and in the future to protect people on a state level? How can we engage people to make sure that that doesn't happen again? Because that is a massive problem and people die as a result of it.
Yeah. So, you know, I'll answer that in two separate avenues. In one way, I absolutely think that there should be a Department of Recovery or a representative that is in the recovery community that is consulted on especially crisis legislation, because if you aren't including our voices, then you don't know things about, you know, program fees as opposed to leases for people in the recovery community. And clearly nobody was trying to leave us out, but the bottom line is that we got left out. And we lost a lot of people. We had an awful lot of deaths when people became homeless, you know, because there was early release from jails or because of unemployment. And those eviction protections didn't protect us. And so, you know, it was really challenging to see that. I do, you know, every time that we're in a situation where funding has to be switched quickly, I know that that is not something that, you know, any government, any state is great at. But the idea that we, you know, we were all for early release from jail so that people weren't getting COVID in jail. But then we didn't shuffle those funds since we weren't paying for them to stay in jail so that they had a place to live when they left. You know, those are things that there has to be a solution out there, right? And I'm holding my hand up. I will work with anybody to find that solution. So, you know, the jail question really does bring me to something that's been heavy on my mind lately. Because, you know, in the work with recovery coaches and peer support specialists that I've done, I see the data that, you know, that the majority of our African American participants come from our jail to recovery community. The majority of our white participants come from our ED to recovery or our pregnancy to recovery programs. They're more hospital based, right? Where we see the vast majority of our African American and Latinx community come in through the jails. We want to make sure that everybody's served appropriately. But intersectionality, diversity, inclusion, this is a moment in history, and I think it's weighing on all of us right now. What are the solutions? Because we don't do great as a state. We're not doing a great job on minimizing health inequities. What are the solutions that people have? And Monty, I'd love to hear from you. I know that you just started out with Voices, but I know that you've got some big things planned. What are you moving towards?
Yeah, I really love that question because it, obviously being an African American and being in recovery, it was really tough to start out with going throughout therapy and stuff, because just like what Fred mentioned earlier, there's that trust barrier, huge trust barrier. So I believe what needs to continue to happen is agencies, treatment programs need to become more culturally competent. They're sitting there and talking about becoming more diverse, providing more diversity programs, but I believe we need to start not just hiring more African American or marginalized population case managers. We need to start seeing more directors who are from the marginalized population, CEOs, et cetera, because you rarely see people of color challenge those who are at the top. So a lot of views, a lot of policy changes are through the lens of someone who's not part of the marginalized population. So with this question, you're asking a lot from a group to trust another group who has historically left them behind. So what needs to happen is people like myself, Fred, others who are part of these populations need to dive into these groups and just focus more on helping out these agencies to become an example of what they're preaching.
Monty, I have a personal question for you. What can I do as a member of the recovery community to make sure that the recovery community spaces that I'm in are welcoming, right? Because, I've seen it over and over and over again where I have one client who is from a different race or culture or religion, and they walk into this room full of people that don't look like them. Is there anything that we as people in the recovery community can do to make it easier to let people know that, that you're a part of our community, and the recovery community is always going to be there to try to support you?
Yeah, I love the question because, like I said, my own personal experience with going through therapy, it was tough. It was tough to open up. It was tough to share. Because unfortunately we do not see a lot of people of color, providing therapy, becoming psychologists or what have you. I think, in all honesty, it's just bringing it up to the individual. That's what happened with me, is a huge thing. Just being able to recognize it, understand it, is a huge stride in bringing down that barrier. Yeah, we have a lot more work to do, and I wish I had all of the answers. I most definitely don't. But I believe that just by understanding that we have more room to grow to become more culturally competent and actually sharing that with the individual is a huge step in the right direction.
This is Fred Garcia speaking, and I'd like to allude to that question as well. One of the things that we have to do, I believe, is we have to do some healing. And what I mean by that is that institutional racism is alive and well even in recovery and in recovery services. And what I mean by that is that, in the early 80s and 90s, the big drug of choice in the African-American community, even with Latinos, was crack cocaine. Mm-hmm. And our solution to that was to lock people up, put them in jail, and there was not even any talk about treatment for them because they were criminals and they broke the law. All of a sudden, you know, the opioid epidemic comes around, and a lot of white people are being affected by that drug, and our answer to that is treatment. How can we help these people? This is now an addiction. This is not a choice that people are making. And I can tell you, you know, what I've heard from my community, and also, and I don't speak for everybody, in the African-American community, we're mad. We're mad because now that it's affecting the white community, now all of a sudden it's a treatment issue. And so we have a lot of healing to do to reconnect with the Latino community and the African-American community. We have to first acknowledge that that happened, and then we have to talk with them about how we're going to move forward. And we didn't need to let people vent about that because people are really upset about that. You know, and I think, you know, right now with the current circumstances that we find ourselves in with the political climate and the protesting and the COVID, I think that's overshadowed that issue, but that's an underlying issue that affects many people of color as we try to move forward with providing services to everyone.
So the fabulous Miss Charlie Daniel was having technical issues, and so she is not on the call with us, but she would be applauding you right now, Fred, because when she formed the African American Opioid Coalition, they spent the first 2 months of their work processing their anger at the injustice. And from there, they found that healing, and they were able to move forward and do some really amazing things. Like they do this med drop Sundays where they go to all the African American churches in the community and pick up do their med drops there. And you know, the AEOC is just, you know, if anybody's interested and cares about diversity and inclusion in the recovery community, please check out the African American Opioid Coalition. They're doing great work.
I'd like to just make an observation very quickly on what you were saying about appropriate methodologies in treatment, and the fact that just before we were talking about Purdue and the fact that the settlement money isn't going to the people who need it the most, but instead to some other, and I'm just going to paraphrase because and I'm overstating. I mean, it's going to go to somebody who knows better, you know, and in some way, I think that part of the institutional racism that has occurred for so long is that somehow people that know about treatment, instead of giving you the money, Monty, I'll give you the money, Fred, and design the programs that are appropriate. I know that finally we're getting money to the tribes, and they have amazing culturally appropriate treatment that it is meant for them. It's designed by them. They did it. And it isn't like some other model that is basically white, you know, always has been, is going to get superimposed and it's supposed to work. I think that has to stop. It just has to stop. We don't know better than you. I mean, anyway, but I think there's got to be a way to get the resources, because then that's how providers will grow. The number of providers will grow. It will grow from itself. Right now, we keep the patients, those in recovery, they're compartmentalized, and they stay right there, and they don't. I don't know. I'm done. I'm sorry.
So
I'm done.
So elaborating on the we're not the experts and we shouldn't tell people what to do. The audience is going to be irritated with me if I don't move on to their questions.
Just say really quick though, Senator Bewley, I not just like very few times do I get to hear a legislator say something and I actually get chills. Like, thank you. Thank you very much, because I wish there were more legislators, not just in your state, but around the country, who had that exact same attitude. I don't think would be as far into this hole in terms of a public health crisis with not just opioids, but addiction in general, if more people had that attitude and allowed us to help lead the way, and people like Monty and Fred and culturally competent leaders in their communities to design these systems, we would be in a much different place. So thank you.
All right, one of the questions that we've gotten a lot is that we keep hearing about Badger Care having a residential benefit, but nobody has seen it yet. Is there any updates on when people with Badger Care will be able to get residential services for substance use disorders? Representative Sargent.
I'll try.
Thank you so much.
I think that one of our basic challenges is that treatment and housing are very difficult to bring together. Housing is typically either vouchers from the feds, which are disappearing. I mean, I think we have the same amount of vouchers being distributed in this country as we did in 1970. I mean, vouchers are so rare, but they're that foundation that allows for the housing cost to be really, really brought down. And if the housing cost is really brought down, then the income, the revenue can go to services. But right now we have to, I mean, look how hard it was to get services paid to counselors in therapy that they had to be in their offices. They couldn't be in the schools. Finally, we got it that you could do it in the schools. And that's kind of similar. We have to make it so that the services can be attached to the housing and then you put them together. Now, there are models for that, and that's supportive housing through tax credits, low-income housing tax credits. But those, again, those projects, it's so hard to build in the supports. They're very expensive and they're so unpredictable. But if we could get the housing voucher in there and slide that into the financing stack, the services would be far more reasonable. But right now they're not. So I guess I'm describing a complex problem that I think we can pull apart and put back together in a way that it could make sense. But it'll take a lot of political will, believe me. And it'll take the feds giving us more vouchers. The feds don't want anything to do with housing. Let's be clear about that. They don't.
Sky? Sky, my understanding DHS was going to be on this call. I mean, you could get legislative opinions on this, but I think this is a question they need to answer. And, you know, I do find some irony. We've been, the last few questions, we've been kind of complaining about Medicaid reimbursement rates, different things they cover, et cetera. Yet at the same time, some of my colleagues want to grow the size of our Medicaid rolls, whereas I come at it from more that the private sector is more the solution than most people want to give it credit for. So, you know, seeing as we do have DHS on the call, I would ask that they answer the question, because our opinions matter, of course, but they're the ones that administer the programs.
Dennis, you want to take a crack at that one? Dennis, you are still on mute. Let me see if I can fix that. And I might not be able to. Oh, there we go. All right.
All right. I wish I had a better answer. You know, I wish there was some of the folks that were higher up the scale from my division that could answer this question a lot better. I've been involved more in just the frontline day-to-day activities and supporting our providers out there. And at the risk of sounding really hollow and apathetic, I know that it's being worked on. I don't personally have any direct detail that I can give to shed more light on it. I know that I have provided my I'll provide my email again. I provided it to one individual in the Q&A. It's out there. I invite anybody to email me, and I will work on connecting you with the folks from our division that have those answers. if I had them, I'd give them. And I don't want to give something inappropriately. So don't hesitate to reach out to me. I know that there's a lot of work being done about it, and it hasn't been easy. And I know we're working feverishly on it. I guarantee you that we're working our butts off to try and respond to our communities. There's a lot of hard work being done, and I'm proud of my teammates and our department. We work hard. We're doing the best. We really are doing the best we can, and we know it's still much more to be done.
So we thank you for that, and I know that I think we're going to send a survey out after this, and so maybe we can include any response that we get from DHS about a timeline on that question, because I know it comes up a lot. So another question that we had come in is around Vivitrol being administered before the release of someone incarcerated. I know that some of the jails and some of the counties are doing that, and some are not able to do that yet. Does anybody have any information on where that's at on the state level?
Well, we actually provided some grants for counties to implement those type of programs. I think 2 budgets ago, maybe it was. They all run together after a while, and we look to continue to expand on success. The state had a pilot program for Vivitrol within the correctional facilities as well. I think we've also been through the best practices recommended by Pew. We don't want it to be just Vivitrol. Now, me as a parent of somebody with an addiction, I have my kind of underlying biases as far as different medical science that I've been used to help move my decisions forward. Say that we should be able to have all different forms of medication-assisted treatment, because not one size fits all. So that we're trying to get to correction system to move to a model that includes all of them.
Thank you very much. All right. I know that I have kept everybody a little bit over the time that I said that I would. And so if you'll bear with me, I'll do one more question that's coming in now. And then after that, we'll go ahead and wrap up. One of the other questions that we had come in is that research shows that a person who is in a structured treatment living facility for 12 to 18 months have a higher long-term sobriety, but there is no financial family in traditional residential treatment or sober living. Does the state have a plan to earmark funds for this? And I think that this goes back to what Senator was talking about with the housing vouchers, to include that as a piece of treatment. But if there's any other ideas on what our state can do to make sure that long-term transitional housing is available for people in recovery, it's your time to speak.
All right, so this is Representative Sargent, and I'll talk for a little bit. I've authored a bill for a number of different sessions that would actually define what sober housing facilities are, and be able to provide a path to fund the beginnings and setting up of sober housing facilities. This is something we absolutely need more of. We do know that sober housing does save lives. It not only saves the lives of people that are living with addiction, but it also saves the lives of their family members, who too often they are depending on for housing, and create codependent, unhealthy relationships with. We have come a far way on that conversation, and certainly we have more work to do, but this is a priority of mine. It has been a priority for a number of sessions, and I have heard the voices of so many people across Wisconsin who are people that are living with addiction, are advocates for people who are living with addiction, and our family members of folks that are living with addiction. And oftentimes these housing facilities are also run by people with lived experience. And it is really important that peer support is rolled into these conversations, and additionally, it's really important that we have at the table people with experience with sober housing. I know it's not easy, but I believe personally that we can't do this without a definition of what these facilities are and what it is that they can and cannot be providing to the people that live in within them, so that we can protect everyone that is involved and make sure that really what we are focusing on is a path forward, is a healthy, productive, prosperous life for the people that are living in it. So I am looking forward to, after this election cycle, being able to continue that conversation and that work. And I am more committed than ever to having it pass, working with my legislative colleagues as well as the Department of Health Services. And any of you that are on the line, please reach out, share your stories, because that's how it is that we get things done.
So just to be supportive of that, of a concept to get there. So there was a bill I authored this session that dealt with recovery housing, in that they could not discriminate based on prescriptions, legal substance, basically to get around houses that were discriminating based on somebody taking, Vivitrol or a controlled substance, I should say, a legal controlled substance that's prescribed for substance abuse treatment. So I think if we get to a place where they accept the best practices, then funding can follow that conversation.
Thank you so much for to both representatives for working on solutions. My takeaway from the call tonight is that although all of our panelists come from different places and are doing different things, every single one of you is trying to move recovery issues forward, and I am incredibly grateful for that. For anybody that is on the call, if you were feeling alone and like nobody cared about you, I hope that this panel showed you that there are a whole lot of people that are working behind the scenes to protect you and make sure that you get what you need. And I'll just say that for anybody that wants to get involved, the advocate community is growing. I would be very happy to have more advocates. So there'll be information to sign up for Wisconsin Recovery Advocacy Project. Please join us. We cannot do this by ourselves. We need you to be involved. And then for anybody who is on the call today that is struggling, and I know that we were talking about some of these systems issues and bigger issues, but if you need help right now, there is 211, there's Wisconsin Voices for Recovery, for the recovery coaching services, there's Stop Heroin Now for housing. Please make sure that you know that we care and that there are resources if the person that we're talking about that is struggling, that we're trying to fix these systems issues to fix, is you today. There are things that you can access, and you're not alone. Ryan, any last words for us?
I just want to thank, I lost my camera. I apologize at getting used to this digital world. Thank you for Wisconsin Voices for Recovery and everyone for joining us. And, hopefully with Sky and Jessica and everyone else in that state, we can all work together towards some of these solutions. I think it was a great start to a very important conversation that is going to continue. And thank you to everybody who joined us online. And we'll make sure to make this also available on YouTube and Facebook and everywhere else. And please stay safe, stay connected, and stay involved. Thank you, everybody.